was on the fence of going to CPI down in Tijuana, and then I just happened to run into an old friend who we got chit-chat, and he was like, funny you say that. This is where I went, and it sort of changed my direction a little bit, because you guys had a protocol for an autoimmune. It was a little bit more defined and a little bit more prevalent when you guys were explaining it to us.
Introduce yourself and tell us what brings you to Medellin, Colombia, and BioXcellerator.
Sure. Charles Ramsey from Tennessee, United States. Have an autoimmune disease, ankylosis, along with diabetes that I got from a pancreatitis issue that I had a few years back. A friend of mine introduced me to you guys. He came in for some shoulder work, was very happy with the facility, very happy with the staff, and recommended it to me. So that's how you guys got my attention. That's why I'm here.
Now, did you look at any other stem cell clinics?
We did. I was on the fence of going to CPI down in Tijuana, and then I just happened to run into an old friend who we got chit-chat, and he was like, funny you say that. This is where I went, and it sort of changed my direction a little bit, because you guys had a protocol for an autoimmune. It was a little bit more defined and a little bit more prevalent when you guys were explaining it to us. So felt a little bit more comfortable with that process, which obviously made me make my decision a little easier to choose.
How about the cells not being imported?
Very important, right? I mean, when you read about, you don't know what you're getting, right? And it's just a concern you always have, just to be able to make sure you're getting a safe environment that has everything, furnished like you guys have it here, and all in one shop. That it's impressive. I mean, it's definitely a decision maker, one of the top ones for.
Now, just tell us about the 3 days you spent here.
My first initial, again, didn't know what to expect coming to a different country from the United States. Your red flags are up just to be concerned and worried, and traveling by myself for the first time, without anybody here. I was pleasantly surprised. When I walked in the door, everybody from your receptionist area to your concierge to your staff, courtesy, respectful, very knowledgeable. I was very impressed with the overall experience that I've had here. Even speaking to some of the technicians, if you had a question, they were able to answer it, and they answered it confidently. It wasn't word fob, right? It was information that I was looking for, and they were able to explain it pretty clearly, pretty quick, which was nice.
Are you type 1 or type 2?
So that's funny. They don't know how to classify it, right? So I had a gallstone get logged in my pancreas duct, which basically blew my pancreas up. Some people, like one of the doctors said, we're probably going to have to classify you as type 1. And some are like, well, we just automatically assume you're type 2 because you weren't type 1 when you were younger. And, so you get different answers for everybody. My pancreas is producing low levels, traces of insulin, but I'm still pretty much insulin dependent. So that was one of the reasons why I wanted to try the stem cells as well, just to see if it gave an uptick at all. I'm not saying my pancreas would ever come back. Obviously, it's not the case, but as long as it can produce some and it can be functional, it's important.
And it can also reduce your insulin intake, because I'm diabetic. I'm type 1.
Okay.
But yes, it's we don't know what we're throwing in our body with the insulin, so it's a
Yeah, I didn't, talk about throwing in your body. I mean, I'm on Enbrel once a week for the autoimmune thing for the ankylosis. And, I went from Humira to methotrexate to, now Enbrel. It's working, but it's suppressing your immune system, and you don't know what biologic you're throwing into your body. So, how many years can you get away with it before, they come back and say, oh, well, here's what we're finding from patients that are taking this long term. So obviously you want to be off any medication you can. Right exercise and eating right's important, but you don't want to have to be on biologics the rest of your life.
Being a diabetic, did you notice a difference in the food here?
Yes. So 100% didn't have to take nearly as much insulin. I mean, United States is certainly dealing with a lot of processed food, the glycogen that kills, everything in your breads and things like that. But it was nice. I mean, the restaurant that was connected to the hotel had 3 great meals. I didn't take much of a trip outside the hotel. I am leaving for a climb that I'm trying to get done. I think it's in the Big Rock. It's about an hour and a half away or whatever. So I want to do that today. But the restaurant inside the hotel was fantastic. I mean, the steak I had was good. I had lamb and I had fish one day. So all 3 great.
If someone's on the fence right now and they're going, Colombia for a medical procedure, or what would you tell them? While
it may be a scary thought, I can tell you that I had that same hesitation, but I'm a lot more comfortable now. Coming here, I didn't feel unsafe. I didn't feel that the facility was any less adequate than what I've ever seen. In fact, I mean, everything here has been top notch. I mean, clean. It's just, you can just tell the detail that goes in here. I would highly recommend somebody to come here and get their procedure. So,
well, we appreciate your trust and your time. Thank you.
Absolutely.